Hello my dear viewers, this is your Vinay voice. So today we are going to discuss about the part 2 session of the tongue. The part 1 has been uploaded. The link will be provided in the description. Go and watch it. And next, so muscles of the tongue. You know that the tongue is highly muscular organ. So there are two types of muscles in the tongue. Those are intrinsic muscle and the extrinsic muscle. So what are the intrinsic muscle? Those are four types. The first one, superior longitudinal. This is the picture, superior longitudinal. And see here, this is the vertical. And see, this is the transversal. And this one is the inferior longitudinal. So superior longitudinal, vertical, transverse, and the inferior longitudinal. So these are the four major intrinsic muscles of the tongue. How to remember? VITS. With the mnemonic VITS. V means vertical, I inferior longitudinal, T transverse, S superior longitudinal. So you can remember the mnemonic VITS. And next, extrinsic muscles of the tongue. See in this picture, this is the styloglossus. Styloglossus. This is the genoglossus, and this is the hyloglossus. The styloglossus muscle attached to the styloid process, and along with the three muscles, there is one more muscle, palatoglossus. This palatoglossus attached to the palate of the oral cavity. So these are the four major extrinsic muscles of the tongue. Those are styloglossus, genoglossus, hyoglossus, and the palatoglossus. How to remember? GPHS, Government Public High School. Government Public High School. G means genoglossus, P means palatoglossus, H means hyoglossus, and S means styloglossus. Right. See in this picture, this is the palatoglossus attached to the palate. Styloglossus attached to the styloid process. Hyoglossus attached to the hyoid bone. And next, genoglossus. This is the genoglossus muscle. And next, so the tongue is a LAQ. When a tongue is asked as LAQ, you need to mention the actions of the tongue. So I will explain the actions of the tongue and with the help of the mnemonic. So the first one is the superior longitudinal. What is the action? Shorten the tongue and makes the dorsum concave. The inferior longitudinal shortens the tongue and makes the dorsum convex. How to remember? Cis, sister, cis. S means superior longitudinal. I means inferior longitudinal. S means shorten. So superior longitudinal S, inferior longitudinal I, they will do the function shorten. Right. Next, transverse makes the tongue narrow and elongated. 10. T means transverse, E means elongated, and N means narrow. 10. Right. Next, vertical. They will make the tongue broad and flatten. V means vertical, B means broad, F means flatten. So they make the tongue broader and the flatten. Right. Vertical muscle. Okay. Next. So remember the mnemonic Cis 10 VBF. Cis 10 VBF. Next. Next, here we are going to discuss about the movements of extrinsic muscles of the tongue. Majorly, there are four types of movement. Those are protrusion, that means forward movement, retraction, backward movement, elevation, upward movement, depression, downward movement. So protrusion, retraction, elevation, depression. The protrusion is done by genoglossus. Retraction is done by styloglossus. Depression is done by hyoglossus. Elevation is done by palatoglossus. And the change in shape is done by intrinsic muscles of the tongue. So how to remember these movements? Mnemonic PG sir did his E project. PG sir did his E project. P. Protrusion. G. Genoglossus. P. Protrusion. G. Genoglossus. S. Styloglossus. R. Retraction. So styloglossus doing the retraction. Next, D. Depression. H. Hyoglossus. D stands for depression. H stands for hyoglossus. So hyoglossus is doing the depression. And next E project, E stands for elevation. P, palatoglossus. So palatoglossus doing the elevation. So with this mnemonic, you can remember the actions of the actions of extrinsic muscles of the tongue. Okay, nice. So next, safety muscle of the tongue. So what is the safety muscle of the tongue? That is the genioglossus muscle. Why? Because these two genioglossus form bulk of the tongue and are responsible for the protrusion of the tongue. If these muscles are paralyzed, the tongue will fall back into the oropharynx and obstruct the air passage, causing choking and death. So this is the importance of the genioglossus muscle. See here, this is the paralyzed left genioglossus. This is the healthy right genioglossus. When there is this type of clinical condition, then deviation of the protruded tongue to the left side. That means the paralyzed side. The deviation will be on the paralyzed side. That is the left side. Next, arterial supply. See in this picture. This is the external carotid artery. From the external carotid artery, we are getting lingual artery. This is the lingual artery. This lingual artery giving two branches. Those are dorsal lingual artery. Dorsal lingual artery. And there is one deep lingual artery. Right. And next, this is the facial artery. From the facial artery, we are getting one more branch, that is the tonsillar branch of facial artery. Next, this is the ascending pharyngeal artery. So these are the arterial supply for the tongue. So those are ascending pharyngeal artery, tonsillar branch of facial artery, dorsal lingual arteries, deep lingual artery. This is the arterial supply. Next, venous drainage. See in this picture, this is the inferior surface of the tongue. So this inferior surface of the tongue will contain two major veins. Those are deep lingual veins. So these deep lingual veins are the major venous drainage for the tongue. Deep lingual vein is the principal vein of tongue and it's visible on the inferior surface of the tongue. So this is the venous drainage. And next, lymphatic drainage. See in this picture, this is the entire tongue. So this tongue will have the lymphatic drainage as follows. See here, this is the digastric muscle, posterior belly. This is the homoid muscle, superior belly. Between these two muscles, there are some lymph nodes. Those are jugulodigastric node, this one. Deep cervical nodes, these three. Jugulohomoid node, this one. Jugulodigastric, deep cervical, jugulohomoid. So this is the apical part of tongue. This apical part of tongue is drained into submental nodes. This is the submental node. Apical part of tongue drainaged into submental nodes. From the submental nodes, it is drained into jugulohomoid node. So the course is apical portion, submental, submental to jugulohomoid. Next, these are the marginal surface of the tongue. So the marginal vessels are there now. Marginal vessels. So from the marginal vessels, the lymph is drained into submandibular nodes. These are the submandibular nodes. And these submandibular nodes are drained into deep cervical and jugulohomoid. So the course is marginal vessels, submandibular, submandibular into the deep cervical nodes or jugulohomoid node. Right. And next, basal vessels. So it will cover the base area. Okay. So basal vessels, the basal vessels directly drained into jugulodigastric node and the deep cervical node. So if the lymphatic drainage asked as a 5 marks question or it may come in the LAQ, you need to draw this entire diagram and you need to give a short explanation. Okay, a short explanation. So next one, along with that vessels, there are some central vessels. That means they will drain the lymph from the central portion of the tongue. This is the central portion of the tongue. They will drain the lymph from the central portion of the tongue. They are drained into deep cervical lymph nodes. Just You draw these diagrams, it's more than enough. Next, the last slide, the nerve supply of the tongue. See here, this is the motor supply. See the statement. All the muscles of the tongue except palatoglossus are supplied by the hypoglossal nerve. All the muscles of the tongue except palatoglossus are supplied by hypoglossal nerve. So this palatoglossal muscle is supplied by cranial root of accessory via vagus nerve. Right. So HMPV. In the HMPV, this is a mnemonic. H stands for hyoglossus. Except muscle. Which muscle? Palatoglossus. The palatoglossus muscle is supplied by the cranial root of accessory nerve via vagus nerve. So you remember the word HMP. H means hyoglossus except the muscle palatoglossus. This palatoglossus is supplied by the accessory via vagus nerve. Next, sensory. See in this picture, this is the anterior 2/3 portion of the tongue and this is the posterior 1/3 portion of the tongue. So this anterior 2/3 portion of the tongue is supplied by the lingual nerve and the chorda tympani. How to remember? Call. C means chorda tympani. A means anterior 2/3. L means lingual nerve. I repeat, C chorda tympani, A anterior, L lingual nerve. So easy to remember. And next, posterior 1/3. It is supplied by glossopharyngeal and the internal laryngeal nerve. How to remember? Go P. G stands for glosso, P stands for pharyngeal. So glossopharyngeal nerve. And next, inla. In means internal. LA means laryngeal. So internal laryngeal nerve. Posterior 1/3. Here P is there na, that means it is the posterior side. So go P. Glossopharyngeal, inla, internal laryngeal. So these are the posterior 1/3 supply of the tongue. So this is about the nerve supply. So that's all for today. Hope you like it. So please subscribe my channel, hit a bell icon and drop a like. Don't forget to share. Don't forget to comment. Thank you everyone. Have a great day.